Continuing our coverage as local communities fight the opioid epidemic, a Pueblo organization is offering a space for people battling addiction through needle exchanges and peer support in an effort to reduce infectious diseases and prevent overdoses. Every Saturday in Pueblo's Bessemer neighborhood.
How you doing today?
Good, and you?
Good, thanks. Your initials?
You'll find labels on shelves and drawers, but as the people who spend their time here will tell you, labels aren't something you'll find being placed on those who need their help.
We just treat everybody like a person.
KJ Bergfalk is the lead peer support specialist at SoCo Harm Reduction Association.
But we provide that level of comfort for people to be able to be like, oh, you've been where I've been. You need another sharps container today?
No.
Okay.
Many weekends, Bergfalk is here, making sure people have someone to talk to and get the help they need.
I get a lot of people that are like, oh, you're just enabling people. Our only goal is to reduce harm to the community and to people.
In the last few years, the organization has offered syringe access programs on the weekends, trading old needles in for new to prevent diseases.
People think of treatment as an event.
Dr. Mike Nierenberg worked as an ER doctor for nearly 25 years. He's one of the co-founders of the organization.
These are people that they have a problem, and I am really happy to be able to try to help them.
SoCo Harm Reduction Association says people bringing in needles are 5 times more likely to seek out treatment options as well.
We have seen it work. We've been getting over 100% returns some days. Those would be on the street.
People have even credited the organization with saving their life.
Let me tell you, when I hear one of those stories, it's good for a month or two of wow, I did it.
As people come in the door, Nierenberg says it's ultimately up to them to seek out additional resources the group offers, such as Narcan, fentanyl tests, and peer support.
It's not the end, it's the beginning. It's the first step.
With any program, funding is a key issue, and drug overdoses have increased throughout the last year.
My goal is to shut this down. Yeah, never happened. They'll never be able to stop it. There'll always be some.
The pandemic has highlighted other challenges in reaching out to key communities.
The inability to FaceTime with people was a distinct limitation.
Hours were reduced to keep staff and volunteers safe, and the center wasn't open during the week throughout the pandemic. He says as governments receive money to combat the epidemic, it could help with accessibility.
We still don't touch the east side. And that's a big part of this, of where the problem is in this town. It would be good to have some kind of center on the east side.
Getting help to those who need it most.
No, thank you. I will. You too.
As we continue our deep dive into this, we wanted to take a look at the numbers. We know overdoses have gone up throughout the pandemic. Now, when it comes to emergency room visits, data from the state shows us that visits have declined since 2017 in Pueblo County. Now, this most recent data, keep in mind, is from 2019. In El Paso County, hospital visits have been on the increase. This is an issue state lawmakers are also figuring out how to tackle by expanding medication-assisted treatment options and conversations even surrounding safe injection sites.
Also,